Hey there VCE HHD students, my name's Andy, I'm a VCE Health and Human Development teacher. In this short video, we're going to look at answering the 2019 VCE HHD exam, question number 9. Before we dive into question number 9, just a reminder over at the Health Resources Hub YouTube channel, a new video is coming out like this one each day between now and the HHD exam this year. If you haven't subscribed, there's a button in the bottom corner of the video where you can do so, and please let your HHD friends know to do so too, so they can access all of those videos. I'm running the 2 ACE HHD exam preparation sessions in the upcoming September holidays. There's just a couple of weeks away until those now. You can book a spot at book.acedvce.com. You can see our social media links there if you'd like to follow us for alerts to the new videos coming out each day, and also our email if you've got any questions or suggestions for videos you'd like me to work on. You can see here the 2019 HHD exam question number 9 was worth 5 marks, and it started with this piece of stimulus material which was a graph. And so always I encourage my students to make sure you're reading all of the information, including the heading and the axes and the key for the graph. So this one here is talking about employed health professionals by remoteness area in 2016. And so you can see then in the key, the different shadings of the bars is related to the different remoteness areas from major cities down to remote and very remote. And along the bottom here, okay, was the full-time equivalent rate per 100,000 of the population. And so A was asking you for 2 marks to use the information in the graph to outline how the availability of health professionals varies according to remoteness. Now you'll notice there it didn't say using data. So if it doesn't say using data and it just says using information, you don't have to specifically use numbers in your answer. So you'll see that the general trend is showing you that as you move from remote, okay, and very remote areas to major cities, there's an increase, okay, in the full-time equivalent rate per 100,000 of employed health professionals. So that would have gotten you 1 mark, okay, by stating that here. You can see there's one example, okay, that doesn't align with that trend or that relationship. And so that is here for medical practitioners and GPs. So it's actually the opposite, okay, for medical practitioners or GPs. So that was the second point that would have gotten you the 2nd mark. And so you can see here that only 24% of students from the examiner's report achieved full marks. It mentions here the correct units must have been used when referring to the graph, okay, and the data. So the graph did not show the number of health professionals in any one region, but the rate per 100,000. So you had to make sure that you mentioned that when you were answering the question. And it says there you had 1 mark for outlining the overall difference, and then another mark for identifying that anomaly of the higher ratio of GPs to people in remote and very remote areas compared to major cities. Then B, part 1, okay, was asking you to provide 1 example of a difference in health status between people living in major cities and those living in remote, very remote areas. So once again, you don't need to have data in your mind for these questions. You could have just said something like people living in major cities typically have a higher life expectancy than those living in remote or very remote areas. Okay, so there's lots of different examples of health status between people living in major cities and those living in remote, very remote areas. So any of those would have been fine. Just making sure that you mention, okay, both of those examples of population groups in your answer when you answer one of those questions. And then part 2 was asking you for 2 marks to explain how access to health professionals could contribute to the difference in health status you provided in that previous part of the question. So you might have said here then that in remote, very remote areas, typically there's less access, okay, to health professionals, meaning that individuals are less likely to have their conditions diagnosed and treated. Therefore, they're more likely to perhaps die prematurely. Then you could say, therefore, this might contribute to a lower life expectancy for people living in remote, very remote areas compared to those in major cities. And so that links back into that example that I just gave in B part 1. And so you can see over here, once again in the examiner's report, okay, it mentions that 58% of students were able to achieve a full mark for B part 1, but then when it came to B part 2, it was only 18%. And so it mentions here in the examiner's report that a common error was to discuss how health status could be promoted if access to health professionals was improved in remote and very remote areas, but that was not answering the question. The question was asking you to explain how it contributed back to that difference in health status. Okay, hopefully you found that video useful. As a reminder, there's the Health Resource Hub YouTube channel, the ACE HHD exam preparation sessions I'm running, our social media, and our email. Thanks so much.